I'm Dr. Cassi of Vetfolio and host of this V2V video on the topical medication Bravecto Plus for cats, sponsored by Merck Animal Health. Joining me today is Dr. Susan Little, a veterinary parasitologist at Oklahoma State University's College of Veterinary Medicine. Dr. Little, we're so happy to have you joining us. Thank you so much for being here today.
Oh, thanks for having me. I'm always happy to talk about protecting cats from parasites.
Yes, absolutely, because it can be a little bit of a challenge to do that.
For sure.
One of the issues we face very commonly in the clinic is convincing owners of the importance of year-round flea, tick, and heartworm protection. And one of the big reasons we hear is that medications can be difficult to administer. So how does Bravecto Plus address that issue, increase compliance, and make it easier on the cat owner and the cat?
Yeah, that's absolutely true. I think we all know from practice experience that it's challenging to treat a cat. And anything we do, we want to try and preserve that cat owner bond, that human animal bond relationship in the family. So whatever we use, we want to try and use less frequently. Now, I personally think that topicals or transdermals, so topically applied but systemically absorbed parasiticides, are about the best development we've had in veterinary parasiticides since I graduated from vet school in the early 90s. I mean, it's amazing to me that we can apply products topically and have them work on internal and external parasites. But, and it's easier. Topicals are way easier than a big tablet or than a messy liquid that you're trying to give orally. But it's true that when we apply a topical, cats get a little wigged out. They feel that product. And so if we can do it less frequently, that's kind of the rule of thumb I use for all things with cats. Once a day is better than 2 or 3 times a day, and every 2 months is better than once a month. And so if we can try and make it easier for the cat and for the owner by having something that's applied every 2 months, then that's going to help foster that relationship between the cat and the owner and keep that bond really close.
Absolutely. Everybody wins. The cat, the pet owner, us as veterinarians, because there's compliance. And then, globally, we're getting much better parasite control overall.
Right. Yeah. The protection is twice as long, and the moment of having to apply it is reduced.
It's much shorter.
Yes.
Bravecto Plus has a 1-2 punch in protecting cats against fleas, ticks, and internal parasites. Can you tell us a little bit about its active ingredients?
Yeah, for sure. So Bravecto Plus is a combination of fluoroliner. So that's the active ingredient in Bravecto that provides flea and tick protection. And so most of us are very familiar with and rely on that. And then the plus is the moxidectin. For cats, the moxidectin in Bravecto Plus is effective against heartworm larvae, hookworms, and roundworms. And then because both fluoroliner and moxidectin are persistent, that efficacy against fleas, ticks, and heartworm lasts longer. And so it only needs to be applied every 2 months to be effective.
So I don't know about you, but I have like this almost like guttural reaction when I hear fluoroliner, because I just remember when it first came out and it was just a huge game changer for fleas and ticks in pets. So when I hear fluoroliner, I'm like, yes, fluoroliner, put everybody on fluoroliner. It made things so much better.
Yeah, I definitely understand that reaction because of that extended efficacy and flea and tick protection for longer. We got so used to having to repeat things every month. And if we didn't, then we would lose control. But now we have products like Bravecto Plus, where you can go every 2 months and get really good protection for fleas and ticks and heartworm and hookworms and roundworms.
So one of the things I sometimes find is that not all cat owners apply topical solutions correctly. What advice would you give cat owners to ensure that Bravecto Plus is applied where it's going to be the most effective?
Yeah, it's true. Even an experienced client that has used a topical product before can do with a refresher. And certainly a new client, maybe new to cats and applying topicals, it definitely helps to show them the best way to apply it. So what we want to do is just part the hair, part the fur, right at the base of the head, so the base of the skull, and then apply the product from the pipette all in one spot. And you don't want to drip it from like several inches or several feet above the cat because it can just run off the fur and drip onto the floor and not be absorbed. But you also don't need to press the pipette into the skin because we're not giving an injection, right? So it's just that the liquid in the pipette should be deposited, should be placed on the skin and then just allowed to absorb.
Yeah, and it's that verbiage, kind of exactly what you just said, I found really changed the game when I was talking to cat owners about applying this product, where instead of like the back of the neck, it was the base of the skull. And all of a sudden, people seem to have a lot easier time figuring out where to apply it. Their cat wasn't licking it off. Everybody was just happier overall.
Yeah, absolutely. And it helps too if the cat, if you find a calm moment when the cat's already kind of relaxing, ideally they're either standing or laying on their belly, that you can distract them with a treat or a toy just to keep them quiet while you dispense the product. So, but I agree that that base of the skull or base of the head is really helpful because that's a larger area to target than the neck, which on a petite cat can be a really narrow space. And then many cats will try and groom it. But if you get it in the right spot, then that's not a concern.
Oh, they're like little owls, the way they turn their head. Like, how did you even get to that spot?
For sure.
Another issue we'll sometimes face is that not all cat owners believe that their indoor cats need year-round flea, tick, and heartworm protection. What do you say to a cat owner that may tell you that?
Yeah, I mean, I understand where some of the pushback is coming from because owners and even some veterinarians just aren't aware of that year-round risk. But we firmly have all the data on our side. We know the risk is there and the science is real. And the cats really do need to be protected throughout the year. And so I just try and share personal stories from my own cats. I have 3 indoor only cats that are protected from parasites year round. I have collected or squashed mosquitoes in my kitchen and found that they had already engorged on blood. And I don't know if that was from the cats, the dog, or a human in the house, but it was a blood-fed mosquito, inside the home. And so I think logically, most people accept that it can happen. It's just more of a habit or a pattern or what they've assumed to be true over the years. And so if we can gently, respectfully push back with some stories, we've already told them the data and the science and the evidence, and that's what we're basing our recommendation on. But maybe if we can leverage some of that emotion and tell them some of the stories that go along with that data, that might motivate them to make a change. And there's really nothing much more tragic than a cat with heartworm disease that's dyspneic, struggling to breathe, has to be supported on oxygen and given a lot of anti-inflammatories to get them through that crisis. And yet it doesn't have to happen. We don't have to lose cats to heartworm disease. We have a way to prevent that.
And you mentioned the tick-borne diseases earlier. Truthfully, if I'm being honest, I don't know that I realized how many pets were affected by tick-borne diseases until I really started testing. And just my eyes were open. I was shocked by how many tick-borne diseases I see in pets.
Yeah, absolutely. And we don't yet have routine approved tests for cats. Hopefully we'll get there because we are seeing in experimental and research work a lot of evidence of infection of cats with the common tick-borne infections that we're worried about. And there's been some nice correlative studies done in dogs that show agreement between antibody positive and renal disease, or antibody positive to tick-borne infection, and other conditions that we can pick up. And so I think we've just started to, look at the tip of the iceberg of what tick-borne diseases are doing to our patients.
So cat owners and sometimes dog owners too can sometimes just forget to give parasite protection on time. What's your favorite way to provide reminder notices to clients?
So there's a lot of good systems out there. The one that's my favorite is the one that would work the best for me, which is a text remind. And ideally a text remind with a feature to click when you've done it. And then you get that congratulatory confetti on your phone, right? That lets you know you've done something good, because it just gives that positive reinforcement, right? It's like you just leveled up on that game, but it lets you feel like a good pet owner. And I think that's what we all want to do right by our pets. We're all trying. And so a text remind with a click that you've done it helps you get that positive feedback that you deserve for doing the right thing. And then the other thing is not having to do it as often. And so there are, there's other systems. You can mail the product every 2 months, but mail can kind of stack up and it may not be given then. But if you only have to do it every 2 months, then that's half as many times you're likely to forget, right? So you've got a better chance of actually administering it by schedule, and you have that longer protection period. So then the cats are going to be protected for longer.
Well, I really like Bravecto Plus because you only have to apply it every 2 months. Thank you so much, Dr. Little, for taking the time to be here with me today and talk about it.
Oh, thanks so much. I really enjoyed this. And I agree. Having something that you only have to apply every 2 months is just such peace of mind and protection for the cat. So thanks so much for doing this.
It's always a pleasure to have you and chat with you about these things.
Same.
And a big thank you to Merck Animal Health for sponsoring this episode. And to all of you out there, remember, if one animal is better off because of you today, it's a great day.
To view full prescribing information, visit us.bravecto.com.